Hi, I'm Dr. George Ho of Vancouver. This movie is the first of the series that I shall teach people how to look after the knee so that the knee can be pain-free and very useful as when people were young until they are old and until they die. Degenerative knee arthritis does not always accompany old age. With proper care, old people's knee can be pain-free and like young people. But many people do not take care of the knee properly. One bad example is that in my 3 decades of chiropractic practice, I've seen many Tai Chi patients coming to me because of knee pain. Most of them have been told by their friends or their teachers that the lower the Tai Chi stand during their practice, the best will be the result. Without real experiences, people would think this low style stance may strengthen their leg. I don't know how many knee has been ruined by this myth. I'm 69 in 2015 and my knees are just like young people. I can play aggressive serve and volley kind of tennis, single tennis, like young people. And then my serve is the combination of a mixed form of Tai Chi power, combining the Qi and the Lei form of Tai Chi power. And then I bend my knees too, but I only bend it split seconds so that I can store up power. You can watch my movie to see for yourself. The movie's name is called Aging Fit, Sing and Hit. You can use that to search, or you can click on the link. Will be in the illustration. There's another myth, especially among Chinese, thinking that training the young people, starting them as young as possible, using the strictest Kung Fu training for them will be the best for them. Now I'll tell you the story of a 60-something-year-old patient that I've seen with multiple arthritic joint problems. The father forced her to undergo strict Kung Fu training from an early age, including some very difficult martial art poses. Because he did not have a son, and then he wanted to the daughter to carry on the family tradition. Now this traditional Kung Fu training has not given her any super good health, but has ruined her young joint. This happens to many Olympic athletes too. Now in this book written in Chinese by the director of Medical and Health Department of Hong Kong, he probably must have summarized the experiences of many Hong Kong doctors who have seen a lot of bad knees. And then he wrote on page 137 that do not twist the knee. Many people twist the knee. They pull up the kneecap and twist the knee. And do not reduce or avoid squatting like doing the Tai Chi move Sha Shi, snake slithers down. In the picture, it's demonstrated by the founder of Wu Tai Chi. His Sha Shi move is the best of among Tai Chi masters, and I'll explain later. Master Wu has a very good reason to do the Sha Shi like this. He cleverly disguised this move as if he was pulling somebody, but actually the move is used to hit the guy behind him. He suddenly squat down. You know, whoever who sneak up behind him might have the leg broken by the buttock of Master Wu. However, if everybody know that you can hit somebody with your butt, nobody will go behind you, right? So when you look at his student and his children and his grandchildren, none of them practice this move like Master Wu, because it's the out secret, it's useless then. But this move will hurt your knee. So nobody of Master Wu's descendant practice it like him. When you look at the anatomy of the knee, it's designed for flexion and extension. That means bending and straightening. And it is at the most stable condition when it is straight with the thigh bone slightly internally rotated and locked into the straight position. And it is the most unstable when it is in a squatting position. From the medical point of view, repetitive squatting will hurt the knee. However, again among Chinese, there is a very popular but very bad health advice telling people that squatting 300 times a day can cure all diseases. I don't know how many knees have been damaged by this bad advice. This is a sagittal section of the knee. Sagittal means cutting the knee from the front to the back. This picture shows 2 bursas. There are at least 6 bursas. Bursa means this kind of soft sac for lubrication. Only 2 are visible here. That means one on the above the patella, and then there's another one in front of the shin bone, the tibia. The one above the patella is called bursa under the quadriceps femoral muscle, and the one in front of the tibia is called bursa between tibia and ligamentum patella. And deep and repetitive bending like squatting would damage some of these bursa, and then would damage some of the cartilage too, leading to inflammation that causes premature joint degeneration. The effect of squatting will strengthen the quadriceps muscle, which is the biggest muscle in front of your thigh. Number 1 and number 2 are 2 of the 4. And you will know why when I explain to you the cause of patellofemoral pain syndrome, which is the most common complaint among knee pain. Now, when the quadriceps enlarge from doing exercises, it becomes shorter because it's bigger, and the pull on the patella, the kneecap, between number 1 and number 2, the 2 muscles of the quadriceps become uneven because they are of different sizes, and then sometimes they enlarge at different rates. One is bigger and then the other is smaller, and they pull on the patella. It was normal before they become large. Now, after they have become large at different rates, the patellar's alignment could change. It is similar to the wheel alignment or wheel misalignment of a car. When one wheel becomes larger, the normal alignment is off, leading to some excessive wear on certain part of the wheel. If you imagine the wheel as the inside of the kneecap and the cartilage and the bursa, and then because of excessive wear and tear on certain part, and patellofemoral pain syndrome, pain will develop. Usually is the medial side of the quadriceps muscle becomes shorter, which is number 2. The picture shows you the cut open knee or from the front. You're looking at the knee with the patella being flipped open, and then you can see the patella and the groove between the two femoral heads that the patella slide in. It's a V-shaped thing above the femoral head. And when the patella, the alignment shifts, there are different location of pressure point develop, and because of the wear and tear, the cartilage will have inflammation, and normal cartilage is very flexible and very smooth. It will not deform easily. It can hold up to 3 to 5 times the body weight. So when you go up and down the stair, there's no pain at all. But damaged cartilage will lose some important component like the sulfated mucopolysaccharide. Now, losing these components leads to cartilage deterioration, and then the cartilage becomes soft and it will easily deform. With this pathological change in the knee joint, people usually experience pain when going up and down the stairs, when your body weight becomes heavier, several times, I guess, when you go jump up and down, especially. From my clinical experiences, I've been a chiropractor for 3 decades. The most common cause of Tai Chi knee pain is patellofemoral pain syndrome. Now, many athletes do weight training. You see some of them, they lift up the weight above the head and then they squat down in order to improve the strength of the quadricep muscle. Now, some of them develop knee pain because some of them they ignore after exercise muscle stretching. If they don't stretch their quadricep muscle after their training, resulting in tight quadricep muscle, putting excessive pressure on the patella and the femur. Tai Chi is a form of weight training on the leg. Now, I do not think too many Tai Chi teachers teach their students how to stretch their quadricep muscle after a round of Tai Chi practice. When treating patellofemoral pain syndrome, treating the quadricep is one of the most important jobs. The shortened quadricep muscle must be treated so that they become normal again. There's several ways to do it, but the most important point is to have an accurate diagnosis. Usually it's the medial quadricep number 2 that is shorter. However, if the problematic muscle is not located, and if you render treatment to the wrong muscle, you could worsen the problem. Pain also has to be treated too, because when there's pain, people tend not to move, and when you don't move, the muscle atrophy, and wasting. That's no good too. Sometimes the cause of knee pain is not in the knee, it's somewhere else. I'll explain in another movie. Now, how much knee bending is optimal for good Tai Chi practice? Please look at the Tai Chi centenarian Master Hu Tu Nan. Not very much. And also, the optimal stand height for doing Tai Chi should be subjectively adjusted by each individual. Now, the criteria will be further explained in the next frame. As long as the individual can feel the Yong Chuan acupressure point in the forefoot and the Dan Tian below the umbilicus, and the throw Dan Tian in the Ming Men of the lower back in the back, when they can react to each other, to help the practitioner achieve the Tai Chi cranial sacral postural reflex called Qi Te Bei and Ding Tou Xuan in Chinese. I'll explain it in the next frame. Now that will be the optimal stand height for you to practice your Tai Chi. And the Tai Chi cranial sacral postural reflex for better posture and Tai Chi is one of my movies on YouTube. You can search, or you can just click on the link which will be in the illustration. Now when you practice your Tai Chi and your static meditation correctly for a certain period of time, you will develop two subjective feelings. One is called Qi Tie Bei, meaning that the umbilicus is sticking toward the spine, and another feeling is called Ding Tou Xuan. That means you feel the head is so light as if it was hanging in the air, and you can see the 4 points that they kind of react to each other if you have this Tai Chi cranial sacral postural reflex. Now on the bottom of the foot is called the Yong Quan acupressure point, and then further up is the Dan Tian under the level of the umbilicus, and then further up is the Ming Men, which is around the umbilicus level and the back, and then further up is the Tro Dan Tian, which very seldom talked about by other people, especially foreign Tai Chi practitioners. Very few people know about this. Any meditative pose should have this Tai Chi cranial sacral postural reflex, and actually from my experiences, this is the static meditative training that give me this postural reflex. And in Tai Chi, this reflex is strengthened. Now in static meditation, it is very important to get into mind-body equilibrium called Ding in Chinese. They enter the state of Ding, which is called Samadhi in Sanskrit. Now in Tai Chi martial art, the Tai Chi cranial sacral postural reflex help the practitioner reach the state of Ding during movement. It is the same in other Qigong practices like the Shaolin Yi Jin Jin, and the Shaolin monk call this the integration of Zen and martial art, Chan Quan Ru Yi, reflected in the integration of the mind and the body. In modern terminology, it is called integrated mind-body training. I have other movie to show you about this integrated mind-body training too. You can search in my channel. And incidentally, lotus sitting, no matter is single or double lotus, if done properly, it would never hurt the joint of the lower extremity. This is my personal experiences after several decades of static meditation practice. Hi, I'm Dr. George Ho. This concludes the movie, and if you like this movie, please click like and please share it with your friends in other media like Facebook, and it would really motivate me to make more movies like this if you would subscribe to my channel. Thank you very much for watching. I'm Dr. George Ho of Vancouver. Thanks again. Goodbye. Subscription is totally free.